quatro apresentações. Iremos começar com o Peter Wintlev Jensen, que é um alto dirigente da Comissão Europeia, da DG InfoSoc, e que está bastante relacionado com a definição de políticas e de investigação e estratégia para a questão do envelhecimento da população e para as implicações disso na sociedade do futuro. I will hand over to Peter. Thank you.
Thank you very much. And I'd also like to thank the organization for inviting me here today to this very interesting event. I hope that I can spread a little bit of light on what we are doing in the Commission in the area of aging and technology. I'm responsible for this area in the Commission, and we've been working the last 4 years to develop an action plan to tackle this issue. So why it's important? So what is happening in our society is that it's changing rapidly towards a much more older part of the population. This is also combined with the fact that the fertility rates are dropping. So in combination, that means that in a few years, the structure of society will change very dramatically. In fact, if you look at the 80-plus population, it will double until 2050. The 60-plus will go from 20% to 25%, which is also a significant increase. So this is changing a lot the way our daily life will be. At the same time, these people start to have problems in using technology in terms of vision, hearing, and dexterity, which has implication when we talk about technology. The most telling figure, I think, is what's called the dependency ratio. Today we have about 4 working for 1 retired. By 2050 there will be 2 working for 1 retired, in some countries even less than that, unless we start to change things dramatically. So you can imagine what that means in terms of being able to sustain our societies, combined with the fact that this growing number of elderly people need substantial increase of care, because with that growing age the care needs will be greatly increased, and intensities of diseases like Alzheimer's and Parkinson's will be much more prevalent because people will be in that age range. This has implication in terms of GDP, because it will cost a lot of money to take care of these people. And also in terms of care staff, there will be a very, very strong competition on the labor market, because there are much fewer people to work, and to attract people to work in the care sector will be increasingly difficult. So that's the challenge side, but there's also a positive side to this, that this situation creates a huge new market for products and services that can address this issue. If you look at elderly people in Europe, there's a wealth of over 3,000 billion euros of those over 65. Of course, we know a lot of people are not rich when they're old, but just in terms of a market for ICT, this is a very significant potential. There are 80 million consumers over 65 today, 150 million by 2050. Today there's only 10% of these people using the internet, so there's a huge real productivity and product potential. At the same time, it has been proven that technology can seriously contribute to these issues. Like, for example, in Germany, there was a study that early patient discharge to allow people to go home earlier using mobile monitoring can save 1.5 billion euros per year just in Germany. And also experiments on telecare at home have shown efficiency gains of more than 25% in terms of the way we can support them at home run institutions. So there's a huge potential at the same time as an economic opportunity. So what can technology do for elderly people? I think it's important to take a holistic view, because elderly people just don't have health needs, they have a lot of other needs. If you want to keep a person 1 or 2 or 3 years longer at home rather than an institution, there are a number of things you need to take care of. So, for example, at work, to sustain the working population, we need to keep people in the labor market for longer, and here technologies can play a key role, like for teleworking, to create work environments that can better accommodate people that start to have functional deficiencies, knowledge sharing, etc. And of course here broadband can play a key role in enabling that to happen. It's also very important to look at elderly in the community, how they function. How do we overcome isolation and loneliness? This is one of the major factors. In fact, 1 out of 4 elderly people suffer from depression, mainly because of loneliness. And here technologies can, if done correctly, can play a key role in bringing them into society, bringing them in contact with other people, with their families, etc., keeping up social networks and accessing public services. Again, here broadband is, of course, a key enabler to be able to do that. Finally, at home, how can we keep people independent for as long as possible? with better quality of life for longer. Technologies can contribute a lot to help people live their daily lives, function, get food, handle their shopping, mobility, safety, like predicting falls, etc., help to call alarms, and also to monitor health conditions in the home rather than in institutional settings. Both because it gives a much better quality of life, but also because there's a factor 100 in difference of cost between people in an institutional setting and people at the home that get the same type of support. Of course, you cannot prevent serious things to happen that really require intensive care, but you can change the curve to extend the time much longer where people stay in their own place rather than having to go institutional care. At the same time, it can also help the care provision because there are big efficiency gains, for example, of reducing administrative burdens from care personnel by using ICT to have more smart workflow management systems that can help managing the care process, which will give a much better efficiency and also better quality of work for those people. So there's a big potential for technology. An example, just to show one example with Alzheimer's disease, which is a very terrible disease that happens to a lot of people. The care costs for those people in Europe were 130 billion in 2005, just for 1 year. And if this is 7.3 million people addressed by that, if you take into account the people that have to care for them as well, this is a huge burden just for one single disease. And here technology can bring big contribution to efficiency gains of that process. It can help people keep them mentally active, activate them so they keep up mental activities, which is an important cause of getting the disease, keep them at home for longer because they can still get reminders to function in their daily life through technology. We can monitor movements so relatives and carers have a chance to tracking them without having to be physically present. It can help the carers organize their work and also that reduce the cost. So the high social impact and a large market opportunity for products and services. But why is it not happening today? I think there's no principal reason why we couldn't do a lot of these things today on a very wide scale. Most of the technologies that are today can really make a difference, but there are some barriers that need to be addressed. First of all, the problem of using technology is difficult for many people, but for elderly people in particular, today's technology is simply too complex for most people, both in terms of the, say, accessibility, in terms of vision, hearing, or dexterity impairments, but also in terms of the skills level. Most of the elderly people today have not grown up with technology, so it's a very hard barrier for them to acquire these skills. There's also the cost availability issue. Of course, for many non-rich elderly people, it's not possible to pay for cost of access to internet today, and that needs to be addressed. Also, the problem is industry has not seen this age group as a market group. Most products and services are designed for people between 15 and 25, and it's clear that those products are not the kind of products that will be attractive to this marketplace. There's also problems of interoperability. For example, typical of elderly people is that the needs change very quickly as their situation changes, and today's product strategy does not allow to easily integrate several services in a cost-effective way and ensure interoperability between different parts of sensors and services and hardware platforms, etc. Also, the markets and business models are not clear today. It's not clear who should pay for this, if not the users. Should the healthcare pay when they don't have health conditions? Should the social care pay? The problem is also that usually you get benefits in another area that pay. So if you improve on the safety, you'll get savings on the health budget. So you need a new macroeconomic model to get the real macroeconomic benefits. You also need to stimulate innovation in the public sector. We heard from Professor Carlotta this morning about social innovation. It's clear in this area there are very few incentives in most of our systems today to drive innovation, because if you become more efficient, you get less money, so there's no incentive for the public sector to invest. So we need to create new policies that reward innovation in the public sector so we can create this positive spiral. So with the right policies, we think we can have a triple win. We can both improve the quality of life for elderly people and their relatives and carers, because keeping people longer at home and giving them support to manage their own situation will lead to that. At the same time, we can ensure sustainability of health and social care in the face of this demographic change, because we need to dramatically increase the efficiency of our care systems. Otherwise, there's no way we can keep the current level of care, and it will be politically very difficult to sustain that. And thirdly, this is an area that can create new business opportunities through social innovation. It's really an area we know we're going to spend an awful lot of money, whatever we do in the next years, and if we can turn some of that money into innovation, that's a huge global market opportunity for Europe. So what has the Commission been doing? We have launched what we call really an integrated approach to this, because it's clear technology alone will not be enough. So we have to change the strategies for funding, the policies, the boundary conditions of legal and other aspects. Only then we will be able to reap the benefits. So we have launched an action plan on aging well, which gives a number of recommendations for how to get there. We have launched a joint research program with member states, 23 countries and the Commission together, on innovation, small target market-oriented projects with a total volume of 600 million euros, where Portugal is a member of, and this is part of a wider political initiative to ensure that as many people as possible can participate in our new knowledge-based society, even when they have handicaps or are geographically or culturally disadvantaged. So the action plan is really about sharing awareness, shared understanding and common approaches, because we can learn a lot, and in Europe there are a lot of things going on, but it's happening on a very local level, so we need to improve the visibility of good practice cases so we can learn from that. We have launched a site called epractice.eu, where there's a high growth of practice cases and community tools surrounding them, so people can get access to the people behind those cases. We are running ministerial conferences to keep the political momentum up at our policymakers. We had a big one in Vienna last year. We are working on conditions to remove the barriers like legal barriers, ethical issues, privacy, security, some of these boundary conditions, where we have launched studies to map out the situation, and we will do benchmarking with the member states to see how things move on. We're also working on accelerating the investment and take-up in innovation. We have a new program called the Policy Support Program, where we do large-scale pilot projects, not to develop the technology, but to show how the technology can create added value, what are the business models, what are the socioeconomic benefits, etc. We're also working on using public procurement for innovation, like you have in the States, where you have to spend 2.5% of your public procurement on innovation related. We are trying to get that model to Europe as well. We are spending 16% of our GDP on public procurement, and in Europe today we have no innovation angle on that. If you can just get some of those percentages driven towards your public procurement in Europe, we will have a strong push. And also we are working with the Commission with the use of the structural funds, because their demographic change is one of the 5 mega priorities for the next programming cycle. Again, for broadband infrastructure, that's an excellent opportunity to get investments going in the infrastructures. And finally, we are also working, of course, in the research, because there's a huge potential for new technologies like smart environments, robotics, etc., to be used in this area. So we have in the framework program, the Yale Joint Program, more than €1 billion investment in the period of the 7th framework program. So this is a huge investment. In fact, it's the biggest initiative in the world in this field. And of course, we would like everybody to benefit from this and use this as a platform for their own initiatives. So just very clearly, we're trying to cover the whole innovation chain, from long-term research to developing the new potential for technologies going into innovation, where we take proven ideas and try to develop them into concrete products and services, and then doing the large-scale pilots where we develop socioeconomic evidence, mainly built on regional projects that work together. This is just a picture showing the first 2 calls of that pilot program. We already have more than 30 regional projects working together across Europe to try to develop solutions, which is a quite large knowledge base to build on. We have also launched what we call the innovation platform, because this area is complicated. There's not one single industry that can deliver all the solutions. So we need to combine experience from telecoms, from ICT, from service provision, from insurance companies, housing companies, user organizations. And for that, we have launched together with a number of stakeholders an innovation platform to develop a common vision, a strategic research agenda, a roadmap, including standardization, policy requirements, and community building to move forward. is just some of the members of that. But this network is fully open, so we invite everybody to look at these documents and react on that. So to conclude, this was a very quick rundown. There's of course a lot more detail on all these things, but in the view of time, I'll just conclude and say this area really has some of the potential that was mentioned this morning for an area where you can stimulate the use of technologies that are already there to push a major societal issue that has big political backing behind it and where a real impact can have. So it's both a social necessity, but it's also a big economic opportunity. ICT really has great potential, but you need to combine it with the policies that will create the conditions for it. We have launched this action plan. We will continue that under the new Commission, and I think it's also clear that the term of social innovation will be a major mantra also under the new Commission to try to stimulate growth and new areas while tackling major societal issues across Europe. And broadband, as I mentioned, is of course a key enabler for social innovation if we can make it available to all, and I think that's the big question, how do we do that so we ensure everybody will be able to benefit from it. So thank you very much for your attention.